everyone. We are going to use this strengthening program for weeks 1 and 2 to really make sure that we are getting the most benefit from it. And today what we're going to focus on is finding our core and trying to engage it safely. Several women in the program have a DRA, and what that is a separation of the rectus abdominis via the linea alba. So this line, this linea alba, is like taffy, and it gets separated because of childbirth or being overweight or other things. But interestingly enough, it looks like it's a protective mechanism. So it's protecting our bodies from other injuries. But at this point, if we've had the DRA and our children are a little bit older, we definitely want that to close over. So what we want to do is we want to find actually the muscle that lies underneath it. We want to find that transversus abdominis and engage that muscle. So this is going to be the goal today, is finding that muscle, engaging it in several different positions, and really trying to work on strength. I think you'll be surprised at how tired you are and how sore you are, but I don't want you to have pain, okay? I also want you to be very aware of your quality of movement. If you feel like, you know what, I'm not doing this well, or this is too hard, or I'm using the wrong muscles, I want you to stop and back off. And then you and I can deal with this together, because again, it's all about quality of movement, quality over quantity, okay? So what we're gonna need equipment-wise is I have a ball, I have a yoga block, I have a balloon, and then I also have a mat for the floor. So we're gonna do a couple things on our knees. So if you have carpet, you have a couple of pillows, whatever you want to kneel on that's a little bit more comfortable, that's completely fine. So the first thing we're going to work on is actually breath work. I've talked to several of you, and so many of us breathe incorrectly, meaning we tend to be chest breathers. We breathe up and down, up and down. And interestingly enough, this kicks off our fight or flight sensations, right? So if we're anxious, we're breathing here, we're not getting that full 360 breath. The other thing is, many of us are belly breathers, but we don't get that rib expansion or the back expansion. So we really want to work on that full 360 breath, because that can actually help address low back pain, and it helps to manage the pressure within our core. This balloon activity is courtesy of Sarah Duvall and her wonderful courses at Core Exercise Solutions. So thank you for that. So grab your balloon. You're going to lie down on your back. And we're going to start in this position, which is called hook lying. You want to make sure that your back is flat, your feet are flat on the floor, your knees are comfortably bent. And what you're going to do is you're going to take the balloon, and what the balloon is going to do, it's going to force you to inhale through your nose and exhale through your mouth. So many of us, especially in cold and flu season, become mouth breathers, right? Because we can't breathe through our nose. So we're trying to work on that connection and make it more habitual. So watch me, and then I will review. So when I do that, I feel my lower abs engage. What you shouldn't feel is you shouldn't feel pressure within your pelvic floor, because when you exhale, your pelvic floor and diaphragm should come up. When you inhale, they should descend. So you want to be careful of that. Again, bringing awareness to the pelvic floor. You also want to be aware, are you crunching up to get the job done? Are you bringing your legs closer? Are you doing anything instead of just lying still and engaging those abs? You want to make sure your back stays flat. If you can't do any of those things, I would recommend going into a recliner so that you're not coming from flat, but then still making sure that you don't flex down when you do it. Because typically when we're sitting, we engage those abs, but not in the way we want, right? We're compensating. So that's why lying down actually kind of knocks that system out. So If lying down is too hard, go into a reclined position. So what we're gonna do is we're gonna do this balloon activity. I want you to do 3 breaths into balloon, and I want you to do it 5 times. We're gonna do it together. One more time. Okay. So when you're doing this exercise, just make sure you're not getting lightheaded or dizzy. You also want to be aware that you're not breathing in and shrugging those shoulders all the way up. While breathing is a chest and rib, belly and back activity, you don't want to isolate one over the other, okay? So the next one we're gonna do is we are gonna grab our ball. So if you don't have a ball, you can use a stack of pillows, you can use a bunch of large stuffed toys that I know we all have, anything that you can squeeze. And you're gonna get back in that same position. So your back is gonna be flat. Your legs, the ball is gonna be on your thighs and on your forearms. So not my hands, my forearms. What you're gonna do, keeping again everything still, is you are going to push your legs and arms into the ball, almost like you're trying to crack a walnut, okay? So you're gonna go push. So as soon as I push my legs up and my arms down, I feel my abs engage. But it's a very safe position because again, I'm not compensating in any other way. It's just my arms and legs moving, asking my abs to contract. So you can see that I'm not lifting up, I'm not tilting back, I'm not pushing with my hands. I'm literally just trying to perform an isometric contraction where nothing's really moving. As you do this, I want you to hold it for 5. Now, as I'm holding this, you can see I can talk through it. Don't want you to hold your breath. Breath is gonna be a big component throughout this whole program. Once you're done holding it for 5, back off. We're gonna do 20 repetitions of this. If you find that holding for 5 is too hard or it's causing you pain in any way, back off to a number of seconds that you can hold safely. Again, quality over quantity. Good. 5, 3, 4, 5, 6, 7, 8, 9, and 10. Now, if that's too easy, or if you don't have a DRA, the next step would be to lift your legs up, lift your arms up. Now, you can simply move your arms back and forth while you hold this position. You can tap your feet down while keeping your back flat, which is going to make sure that your core is fully engaged. Or you can combine it and do the full dead bug, like this, tapping down, or extending the legs. So I want you to make sure that you're doing things at the appropriate level for you, because if something's too hard or too easy, you're not going to get the benefit. So complete that, the total of 20 repetitions of whatever exercise level you desire, and then we'll move on. Okay. So the next activity we're going to do, same position, back is flat, arms can be wherever you want them. And what we're going to do is we're going to make sure that we're engaging that transversus abdominis, so that corset muscle. And how you do that is you find the bones right at the front, they should stick out, and you just move inside towards your belly button, and you sink deep into the tissue. And what you should do is try and bring that belly button towards your spine, like you're trying to zip up tight jeans, and breathe out at the same time. So as I do this, I'm able to talk and hold that contraction, okay? So breathing out stops us from holding our breath. So you're gonna breathe out, hold that contraction. You should also feel your pelvic floor engaged, because our transversus abdominis and pelvic floor have a connection. So once you find that muscle, I want you to engage it. And now what we're gonna do is we're gonna do what's called bent leg fallouts. So keeping that muscle engaged, I want you to bring your leg out and back in and out and back in. Now relax, re-engage, and do the same thing. So I want you to try 20 repetitions on each side, making sure that after each fallout on each side, you're relaxing that muscle and then re-engaging before the next repetition. The key to this is, if we try and hold it the whole time, we're not going to be able to do it. We're gonna lose the contraction, and then we're not gonna be able to notice when it falls. So if we relax actively and re-engage actively, we'll be able to notice, and it'll become more habitual, okay? So engage, bent leg fallout, and back in. If this is too easy, if this is too easy, you can wrap a band around your legs if you have one, and have resistance as you're going through this. You can also take your balloon, excuse me, and try and blow up the balloon while you're doing it. So you can also hold a weight up over your chest while you do it. However challenges you most, okay? So whatever you do, you wanna do a 5-second hold 20 times, unless you're doing the balloon. Be aware of the balloon, because you will get lightheaded if you do it too much. Okay. All right, so the next one is heel slides. And again, these exercises might seem simplistic at first, but again, we're trying to create some body awareness, engage those abdominal muscles that are often overlooked. And honestly, many of us go beyond the basics and go into planks and say burpees without getting this basis taken care of, and that's where we end up injuring ourselves. So same thing, re-engage that TA, and then you're gonna do some heel slides. So this one's a little bit more advanced, because you wanna make sure that not only is the TA engaged the whole time, you want to make sure that your back stays flat. So luckily one comes with the other. So now again, just like we did with the bent leg fallouts, you're going to engage that TA. You are going to slide down and slide down and then relax completely. If you can't hold the contraction that whole time, break it up by side. So it'll be 1, relax, 1, relax. I want you to do a total of 20, same thing on each side, making sure that you're engaging that core the whole time. Okay. So now, staying in that same position, you're gonna take a yoga block, a ball, a pillow, whatever you have to squeeze, and you're gonna stick it right in between your knees, okay? So now, in this position, we are gonna do a bridge. Bridging can sometimes be a little uncomfortable on the low back, so we're gonna see if we can tweak it, okay? So squeezing in on the yoga block or whatever you have to squeeze. You're also gonna try and squeeze your tush and bring your belly button towards your spine. Now, that's a lot to ask for, so that's why this is all about body awareness, okay? So squeeze the brick, squeeze your tush, bring your belly button towards your spine, and then lift up. Lower back down, and relax everything. So, squeeze the brick, belly button your spine, squeeze your tush, lift up, lower back down, and relax everything. So you can see that I'm not lifting very high, but it doesn't matter. No matter how high you lift, you're still engaging those muscles. So that's really the point. Again, quality over quantity. You're gonna get sick of me saying that. If you have pain at all throughout the movement, take out one of the contractions. So if your back is hurting, just try and squeeze the brick and lift. See if that made it better or worse. Then squeeze your tush and lift and see if that made it better or worse. And then bring your belly button towards your spine and see if that made it better or worse. There's lots of ways that just engaging the right muscles can change how an exercise feels and make it more attainable, okay? So same thing, I want you to do 20 repetitions of that, nice and slow to whatever height feels comfortable. More isn't better. All right, so now the last exercise in this position, same thing, you are gonna take your yoga brick, you are gonna take your pillow, your small ball, whatever you have available to you. And you are going to engage that TA. You're gonna be really good at it by the end of this video. Bring that belly button towards your spine, hold onto the brick or the pillow, and you are going to lift this up over your head. Then you're gonna slowly bring it back. So you can see that as I lift over, a tendency would be to arch my back to get the job done, but that's not what we want to do because then that's not engaging our core. So making sure that TA is engaged, lifting up, coming back, and relaxing. Again, I'm holding that contraction the whole time while I'm talking, so you should be able to do the same. If not, limit how far you go with the object, or engage, come down, up, relax. Make it a shorter range of motion. So if the shorter range of motion doesn't work, you can also just put your object down and just lift your arms up. Adding that additional weight, even though it's not that heavy, really does make a difference. To make this harder, you can use a dumbbell up overhead, or you can be up in this bridge position and make it harder. just like that, okay? Same thing, we're shooting for 20. Okay, so now we're gonna get on hands and knees. Okay, now we're gonna get on our hands and knees. So I'm gonna get off the table, come down onto my mat. Okay, so we're gonna come down into what is called quadruped, and that's hands and knees. You wanna make sure that your knees are under your hips and your hands are under your shoulders. And what we're gonna do is we're simply going to weight shift. So you're gonna shift over your hands and then come back. If you need to move your hands a little farther forward to make it a little bit more comfortable, that's fine too. You're gonna shift forward and back. Now this is a precursor to bird dogs. Traditionally, bird dogs are opposite arm, opposite leg. But what I see in physical therapy is that a lot of people just shift their weight over to the leg side, and then they're not getting a lot of core activation. So we're gonna break it down into its components, which is why we're gonna start here, shifting forward. And again, this is one of the surprising exercises that you'll be shocked that you can feel your core engage as you do this. Same thing, I don't want you to have any pain while you're doing this. I don't want to see a lot of movement like a cat-cow. That's not what we're looking for. Truly just shifting forward and shifting back. If this is easy for you, then what you can do is you can go into leg motions, making sure that you don't shift side to side, that you're keeping your weight equally through the three limbs that are really bearing the weight. You can also see that I'm not lifting my toes up in the air, so that's I'm preventing a lot of compensation. The next level would be to lift the leg. And then the final level is to do the final bird dog. So whatever level you feel the most comfortable with and the most challenged with, I want you to do it. But I want you to be able to do 20, feel tired, but not be completely wiped out. So you might have to do a trial and error and figure out what works best for your body. You can also combine them. So if you feel like you did 10 weight shifts forward and you wanted to do 10 leg movements and you still feel like you have good quality of movement, fantastic. So while I'm giving you guidance, I really want you to make this exercise program your own. So you probably are going to want to take notes and make sure that you are making progress, but also what you needed to do on one day so you can either replicate it or challenge yourself on another day, as long as you're challenging yourself safely. Now, the last two exercises we're going to do are going to be in this kneeling position. If this is uncomfortable, then I will make sure to give you options. So in this kneeling position, you are simply going to kneel to a full kneel. So seated kneel, full kneel. So you can see when I come up, I make sure I engage here and I engage my tush, and I'm sitting up nice and tall, okay? I want you to think about this. I don't want you to just quickly go through it, because then you're not going to get that full expansion, full extension. And this will also help too if you have tightness in your hip flexors, okay? If you have trouble with this, you can use a yoga block to help you get off. You can use a yoga block on either side. But again, I think you'll be surprised at how you feel with this. You can either keep your knees closer together, which is going to give you a little bit more challenge, or you can have them a little bit wider apart, whatever feels most comfortable for you. So if this is too easy, you can hold your yoga block if it's got some weight to it, or you can hold a weight here, and that will definitely make it harder. For this one, you could probably do 20 to 30 repetitions. It's really good to work on the quads as well as the core, so it'll be a really nice addition to the program. And the last one we're gonna do is we're gonna do what I call a kneel to half kneel. So you're in this position and you are gonna switch and put one leg up, and then you're gonna slide it down. And one leg up and slide it down. This is actually a balance activity as well as a strengthening one. And this is the one that sneaks up on me because, again, you're forced to balance. You have to shift from side to side. You have to keep yourself upright. I'm not using any hands or anything for stability. If you feel like you need to, you can absolutely do that, no problem. But I think you'll be surprised at how hard this is. Now, if this is too easy, you can come from here to here and down to down, here to here, and down to down. So that's another way to advance it. If being on your knees is uncomfortable, what you can do is you can put some pillows underneath your shins so you're directly on your knees themselves. Or you can just scrap that exercise altogether because I don't want you to be uncomfortable or have to lean on your knees too much. So that is your exercise program for weeks 1 and 2. I hope you find a way to challenge yourself appropriately. If you have any questions or concerns, don't hesitate to reach out to me because I want to make sure this is effective for everybody. So find those balloons and get started. Have a good day.